We have a health alert. All Children's Hospital has contacted all the families whose children were exposed to an outpatient therapist who died Monday from a contagious infection that can lead to meningitis. Today, as they continue to notify staff who may be affected, they want the public to know that the hospital is safe, the general public is not at risk, but they also want you to be aware of two key facts about this infection that could save lives. Dr. Juan Dumois, the director of pediatric infectious diseases at All Children's Hospital, has spent the last 2 days answering questions about a blood infection that likely killed an All Children's outpatient therapist.
It's an organism that we call meningitis, and this organism has the potential to cause very serious life-threatening blood infections, and sometimes once it's in the blood, it can get into the brain, and that's when we call it meningitis.
Transmitted by saliva droplets, the blood infection is sneaky and fast.
Well, the initial symptoms of this infection can be like the flu, just fever, achiness, some congestion or cough, and just feeling really lousy.
But in some cases, the illness can progress from flu-like symptoms to death in just hours. The one unique clue that sets this deadly affection apart
would be a rash that can start off as little red or purplish spots that do not disappear when you briefly press on them. And sometimes these little pinpoint spots can enlarge and become large purplish splotches on the skin.
Those symptoms, the doctor says, tell you to go to the ER immediately. You can be a carrier of this organism and not ever get sick, but there are certain people who are at greater risk. They include those under 1, teenagers, smokers, and if you are a carrier and you get the flu, influenza is also a risk factor. In the case of the outpatient therapist, who the hospital won't name due to privacy laws, she would have been touching patients. So, as a precaution, they're notifying those who had recent contact with her and are offering them antibiotics. Children are getting 2 days of the drug rifampin. And most adults only need 1 dose of Cipro to protect against the deadly infection. And the doctor stresses there is one very good way to lessen the chance your children will ever get that sick.
There's a very good vaccine that covers most of the strains, like 80% of the strains that cause this disease. It's normally offered to children at about 11 to 12 years of age.
As for the outpatient centers on All Children's downtown St. Pete campus, it was business as usual.
This is not something that lives on surfaces. It's not something that survives in the furniture or in the air ducts or anything else like that. So there's no reason to be afraid of those spaces that provide outpatient care, and certainly no reason to be afraid of any of the spaces in the hospital itself.
The Hillsborough County and Pinellas County health departments have been notified, as this is a reportable disease. So far, both the doctor and both health departments tell me they have no other reports of anyone else getting ill. Now, to put this in perspective, the Pinellas County Health Department says this is the first report this year in their county. Last year, they had 10 cases of meningitis reported and 4 cases of the blood infection.